I'm Ben C.,
I'm Dr. V, the medical legal guys. Hello, I'm Dr. Vigna. We are seeing some very big bed sores coming from level 1 trauma centers. And this is quite disturbing because level 1 trauma centers are supposed to be an exceptionally safe place for people who have suffered serious injury or illness. And we are seeing bed sores develop at level 1 trauma centers, and simply these facilities, their doctors are discharging these serious injuries to nursing homes without future treatment.
I agree with you. A level 1 trauma center, if you go to downtown Dallas, Texas, or near downtown Dallas, Texas, you're going to see Baylor Medical Center. It's a level 1 trauma center. You go to Parkland Hospital, level 1 trauma center. Other cities, if you see those big hospitals that are taking in a lot of patients and they have staffed emergency rooms, those are mostly going to be all level 1 hospitals. There are hospitals that aren't level 1 that are certainly great hospitals and do good work, but they're just not of that ilk, right? So it's very unusual that you would think that you would see neglect and bed sore type developments in level 1 trauma centers. It just shouldn't happen.
Yeah, so we have two cases that come to mind, one from the University of Chicago, a level 1 trauma center, and one involving the University of Pennsylvania, level 1 trauma center, Lancaster General Hospital. And in both cases, our client was discharged to a lower level of care and without a treatment plan that would provide a pathway to cure. These bed sores are serious injuries, and the literature shows that stage 4 bed sores that go down to bone with infection have a death rate at 1 year of 17%. 44% of these patients with stage 4 bed sores that involve bone will be hospitalized again at 1 year. For these level 1 trauma centers to market themselves as the safe place for people who suffer trauma in the community and are life flighted to that hospital, but at the same time, these hospitals are discharging trauma that occurs in their hospital without taking care of the trauma that they cause our clients. We find that
Unacceptable. Unacceptable, and quite frankly, should be the subject of action. And in our case, action in the form of a lawsuit. When Dr. Vigna talks about trauma, the development of a bed sore generally comes from the lack of turning the patient. It's a never event. Medicare says it should never happen. Medicare says we're not paying the hospital for bed sores that it causes, and they don't.
Level 1 trauma centers have 24-hour trauma coverage. They have 24-hour in-house neurosurgery coverage. They have every specialty involving trauma. That a level 1 trauma center has all the specialists in the hospital with the skills to be able to fix a bed sore. There are requirements of coverage and services provided. There are requirements in terms of kind of a multidisciplinary approach, an approach to care that provides a safe environment of care, communication within transfers from one floor to another, and protections for the public as to the institution, that a level 1 trauma institution should be a safe place, top to bottom. For patients to develop a stage 4 bed sore, we understand that these things may happen, okay? And they're the results of negligence. But for a level 1 trauma center, with all the specialists in-house with the skills to manage a bed sore, to simply discharge patients to fend for themselves with a gigantic sore to a nursing home or lower level of care without the specialists who can manage these types of problems, it's very disturbing. And personally, I unfortunately had 2 grade 4 bed sores that occurred under my watch in 25 years of providing inpatient hospital care at a rehab hospital. And in both cases, I didn't discharge the patient. I figured out a way to find a plastic surgeon to fix these wounds. I managed the wounds, I prepared the wounds, and we cured the wounds. And I did this at rehab hospitals, okay? And for a level 1 trauma center to take care of trauma, but not take care of the trauma that occurs in their facility, it's despicable conduct, in my opinion.
It's almost unbelievable. It is believable because it happened, and it's happening a lot. We represent a lot of people, a lot of families whose family members have had this event, the development of a decubitus ulcer, also known as a bed sore, also known as a pressure sore. And a lot of times they do happen in nursing homes where the level of care is many times less than a hospital. Quite frankly, they happen in step-down nursing facilities, long-term acute care facilities, short-term facilities, and basically any type of hospital you can find. There are folks that unfortunately and tragically have developed these bed sores through the negligence of the folks at those facilities. We talk about the level 1 trauma centers. It happens everywhere. Just really surprising, the level of this mismanaged care. And we have reason to believe that there are serious basic reasons for it that have nothing to do with the hospital itself, except for who owns it and what kind of money is being spent on the care and what kind of employees are they able to hire, because what are they doing with the money that they're making? Who is this? Is this going to investors? Is this going back into the hospital to help treat patients? And we're seeing more and more and more that it doesn't appear that the folks are churning back in the money that's being made into their care, and that it's almost profits over safety. And profits over safety leads to tragic events. And in many instances, it is the seminal reason why the bad care occurs.
And the level of ambivalence for treating physicians where a wound occurs under their watch, I find very disturbing. The nurses that were on my ward and at my hospital, if there was a pressure injury, they were to call me. They knew I would be showing up, and I would tell them when that patient should be ready in turn with the wound care team. And we would make steps to make that patient safe. So these level 1 trauma centers, they're not only causing the bed sore, but they're not acting affirmatively to make sure that patient is safe from further injury. They're not acting affirmatively to make sure that they have a treatment plan in place for cure, which would be ensure nutrition is adequate, to ensure that there is reliable pressure relief, to ensure that the wound is properly debrided to viable tissue, that the wound is not infected, that when the wound starts granulating in, that a plastic surgeon is then available for closure. And they're just not acting affirmatively to make a person safe and to treat. So we are suing them for negligence for causing a bed sore, as well as unsafe discharge.
That's right. Thank you very much.